Welcome back to the channel. We continue with some of the clinical presentation of sinusitis. Then we will start with OAC and OAF. Okay, let's start. Clinical presentation of sinusitis. There are major factor and minor factor. What are major factor? Facial pain or pressure, facial congestion or fullness, nasal drainage or discharge, nasal obstruction or blockage, hypoxemia or anosmia, मतलब loss of sleep or less sleep. These are the major factor for clinical presentation of sinusitis. What are the minor factor? Headache, maxillary dental pain, cough, halitosis, that is bad breath, fatigue, fever, ear pain, pressure or fullness. Okay, so these are divided into two things, major factor and minor factor. Clinical presence of sinusitis, either it can be acute or chronic. Okay, now what are the complications? There are some sequelae to sinusitis, or we can call the complication of sinusitis. First is bony complication, which can lead to osteomyelitis and Pott's-Puffy tumor. Then is locoregional complication like pharyngitis, laryngitis, otitis media or mucocele. Now orbital complication, which include cavernous sinus thrombosis and preseptal cellulitis, orbital abscess or orbital cellulitis. These are the orbital complications. Now intracranial, same CST, that is cavernous sinus thrombosis, then epidural abscess, subdural abscess, intracranial abscess and meningitis. So these are the clinical presentation and complication of sinusitis. So we are over with sinusitis. We have seen the features, we have seen the type, we have studied acute sinusitis, we have studied chronic sinusitis. Now we are coming to oroantral fistula and oroantral communication. What is oroantral fistula? It is a persistent epithelialized communication between the maxillary antrum and mouth. Persistent epithelialized communication between maxillary antrum and mouth. Persistent is a keyword. Okay, persistent OAC leads to OAF. Now coming to OAC, that is oroantral communication. It is an communication which is abnormal, unnatural connection between the oral cavity and the maxillary sinus, and when it becomes persistent and epithelialized, it is known as oroantral fistula. So first there is communication, then there is fistula. Persistent oroantral communication leads to fistula. Hope I am clear. Okay, we will be using simultaneously both of the term. Now there are types of OAC. First is alveolar type, which is a common type, follows traumatic dental extraction. It happens due to traumatic dental extraction. Second is sublabial type, as a complication of Cardwell-Loop procedure. Now there is palatal type, which is followed by malignancy, trauma or following any maxillectomy procedure. Okay, three type of OAC is there: alveolar type, sublabial type and palatal type. Now next, clinical presentation of sinusitis. What are the clinical presentation of sinusitis? So we have done then we have done oroantral fistula. Now etiology of oroantral fistula or oroantral communication. Divided into two: dental origin or non-dental origin. Dental origin is also called as an odontogenic origin, which include dentoalveolar or implant surgery, chronic infection or post-extraction of premolar and molar for oroantral fistula or communication. Now what are non-dental origin etiology? Surgical procedure like enucleation of larynx, facial trauma, pathological like osteomyelitis of maxilla, sinus surgery, orthognathic surgery, lithotostomies, malignant disease, radiotherapy, extracted maxillary dentures, or iatrogenic, that is injudicious use of elevators. Okay, these are all causes of OAF or OSC. Okay, so we have done with the definition of OAF and OSC. We have done the type of OAF and OSC. Then we have done with the etiology. Now there is a predisposing factor. Solitary isolated maxillary molars are most commonly associated with OAF or ASC. Fractured parietal root of maxillary molar. These are the predisposing condition for OAF or OAC. Possible sequelae in general systematic toxemic condition. Okay. Fever, headache, malaise or insomnia. These are systemic, general systemic toxemic condition following OAF or OSC. Okay, that's all for today. In next class, we will be dealing with the signs and symptoms